So my name's Kayla, and my project is on increasing pneumococcal vaccination among children with nephrotic syndrome. Slide change. Oh, sorry. So we found that nephrotic syndrome has an increased risk of invasive pneumococcal disease. Guidelines recommend children receive pneumococcal polysaccharide vaccine at the time of diagnosis. Despite this, most children with nephrotic syndrome followed at the JPCH have not received their pneumococcal vaccination. We did a retrospective study of previous patients that had been followed here, and only 37.5% of the patients received pneumococcal 23 vaccine, and the time to first dose was 1.8 years from the initial diagnosis. We utilized a fishbone diagram to investigate our root cause analysis and discover why the problem existed within our context. I then used a driver's diagram to identify change ideas that would be able to combat our problem, and used a stakeholder analysis to create a team to help achieve our goals. So we did do a retrospective data since 2007, and the mean time from diagnosis to the first pneumococcal vaccine was 274 weeks. And while when you look at the run chart, it looks like there's an overall trend in more recent years, this is still far, far below our target. With that information in mind, we created a primary aim for pediatric patients with a new diagnosis of nephrotic syndrome to achieve an 80% vaccination rate by their 12 to 14 week visit. And furthermore, with those with an existing diagnosis of nephrotic syndrome, we wanted them to achieve a 60% vaccination rate. So we created a pre-printed clinical order set for the admissions of new and existing nephrotic syndrome patients within the pediatric inpatient department, which included pneumococcal vaccination orders, as well as a QR code for further information about pneumococcal vaccinations. In addition, we did a pediatric outpatient department standardized order set for identification and administration of the vaccination in their outpatient clinic visits. Unfortunately, because of barriers during the pandemic, we have only just implemented this new intervention, and thus only the plan and do stages of the first PDSA have been completed. But within time, we hope to do the studying and acting part until we achieve our goal. So in terms of key learnings, this was a fantastic program that I was honored to be a part of. There's lots that I learned during this course, but my main takeaways are to not start with a solution, that planning is the most important stage, and that change is slow, and so not to get discouraged when things aren't going as predicted, and that improvement takes flexibility and teamwork. And that's everything. Thanks very much.